asked to introduce myself to speed things along. So I'm Nick Cavill. I'm an independent consultant working in public health issues. Generally, quite often my focus is on obesity, physical activity and diet. And I've done a lot of work on active travel, hence I guess why I got the invitation to talk about active travel and productivity. And actually it's not something I've particularly thought about before, so I learned a lot preparing this talk. Because to my mind, I've read loads of stuff like this. I'm always digging around with these infographics that say walking's the best thing since sliced bread and the benefits of cycling. And I always assumed that reduced sickness absence and increased productivity were two of the main arguments that the active travel advocates like me use. And actually, when I googled around and looked at some of these infographics, it was pretty hidden. I couldn't really find groups, couldn't really find too many examples of that. How do I get the point again? Mostly, very good arguments about enhancing community, about how walking helps the local environment, and of course the public health and the physical health aspects. Same with cycling. When we talk about the benefits of cycling, I'm sure as an audience, the public health audience, you know very well the benefits for physical health of increased physical activity, and things like walking and cycling can get people to do that every day. But I was thinking, well, what have we got? We've got some arguments here about jobs. This is cycling walking projects creating jobs, and we have some arguments being made about sort of mental health and relaxation in the workplace and so on. So then I begin to think, well, maybe this story isn't quite so strong after all. Maybe I've been asked to Birmingham to talk about how wonderful cycling and walking are for productivity, and perhaps the story's not there. So let's carry on. So I dug around a bit more and found a study from the Dutch economic think tank that does talk about saving employers millions in lost productivity from absenteeism. But really that was, as I say, looking a little bit deeper into the, like the second page of Google or the third page of Google. All good scientific research starts with Google. So I thought, let's get a bit more systematic here and think, well, what is the link supposed to be between getting people, reaching programs or projects that increase cycling or walking, getting people to walk and cycle more? How does it, hang on, we need a logic model. I'm a big fan of logic models, and we've seen a few today of things set out, and I deliver training and stuff on logic models to help people think through things clearly. So we did a logic model. And what I tried to set out here were the connections. What are we assuming? Well, first of all, we said, does physical activity increase productivity? That's quite a jump. So what's happening in between? Well, I guess we're assuming, aren't we, that physical activity improves health. Chief Medical Officer talks about over 20 health conditions, and that these are mediators to improve all aspects of health, physical and mental. And of course, if we want to reduce sickness absence, the intermediate indicator is reducing sickness itself. So this is what we're thinking about, isn't it? Getting people healthier and fitter, reducing sickness, therefore increasing their productivity because they're there more often, but also improving people's overall quality of life, improving their mental health, reducing stress, and perhaps this issue of reducing presenteeism. Then I thought, well, and then what are the arguments that are actually made? Well, certainly, anecdotally, people say, those ones, the ones who cycle and walk to work, or actually cycle and walk into school, people are much more alert when they get there. I don't know if, as individuals, if you find that. I found it this morning on my very hazardous journey from New Street Station on my bike, so I was certainly more awake. So I guess there's also a sort of a more direct connection that more active people may actually be more alert when they get to work, more awake and ready to get going. So I thought, let's just try and use this quite briefly to explore the evidence behind these different connections and see what the story actually is. So first of all, kind of the big one, physical activity and productivity. There's a systematic review done on this issue, specifically about worker productivity. And I'm afraid the evidence is not particularly supportive at this sort of level. So you understand that these are reviews of multiple studies. They pull everything together. They sometimes run the risk of losing the nuances within individual studies. But it does give us a good first place to start because it's a review of existing evidence. So this one from 2015, just a couple of years ago, says on-site work, this is health-enhancing physical activity programs, do not reduce the level of sick leave. And they talked about inconsistent evidence of the impact of on-site programs on productivity. So not particularly good news from the first review I found. Second one, from the sort of sports, so that was from the occupational health people. This is from sports medicine people. A little bit more positive, limited support of physical activity, so not just active travel, effectively reducing sickness absence, but they worry about the low quality of many of these studies. So that got me worried a bit. And then I began to think, well, would we expect this really? As we've talked about all morning, this is a complicated and tortuous path with many different variables, many different things that can change, many different possible confounders. So would we necessarily expect a direct influence, a direct relationship between things at different ends of the model? So what about the sort of intermediate areas? Well, we certainly know, and I'm not going to bother to review this level, this area of evidence, because we certainly know there's extremely strong evidence for the health benefits of physical activity. Chief Medical Officer's report brought this together a few years ago, building on evidence from the US. I'm sure that we're past the stage now where we have to make the case for the strength of the evidence around the benefits of physical activity. The issue to me is, what do we do about it? So do workplace programs and active transport programs help to increase active commuting and physical activity? And also, what actual additional benefits are there? And of particular interest to this conference, what productivity or economic benefits are there? So we did a review a few years ago with the City of London Corporation. So this was dealing mainly with the big employers that are based in the city, so big financial institutions. And we reviewed the evidence for the effectiveness of workplace-based physical activity programs. And we found that to be pretty strong consistent evidence for these types of things that could make a difference to employees' physical activity level. We didn't find within that literature review a great deal of evidence on active travel, so walking, cycling, although there was a lot of talk in this literature about walking or cycling challenges. So this is sort of websites that you sign up to do a fun run or a certain number of steps per day or so. Certainly when I worked on some of the evidence for the NICE review of physical activity in the workplace, and NICE was very strong about the role and the importance of walking or cycling to work as part of an employer's health promotion or physical activity policy. So we've got some pretty solid evidence, I think, that physical activity can be increased through a range of interventions, either in or connected to the workplace. So this is only a single study. I've looked at reviews mainly so far, but Annette Mutri, quite a few years ago now, did this really interesting study called Walk In to Work Out, which was just about finding people who, in a workplace, who wanted to walk or cycle more, so they had to be motivated to do so, and delivering a tailored intervention to them. So basically sitting down and talking to someone, where do you live, where do you work, how would you like to get there, what are the different ways you could do it, and so on. Let's look at some maps, let's look at some bus stops, let's explore the reality of it. And whoops, I keep pushing the wrong button. And they doubled the rate of walking, but not cycling. They doubled the rate of walking to work to a relatively simple but highly targeted intervention. Cycling in this instance was found to be too many additional barriers. And indeed, other review level evidence has really found quite strong, given us a very strong steer on the types of things that are effective and cost effective in promoting walking, cycling, both in terms of Cochrane level reviews and individual reviews in the BMJ, both on separately on walking and cycling. So I think we know what to do. We know that workplace programs work. We know that the workplace programs can increase active commuting and levels of physical activity. We know that the health benefits of that activity are strong. It's really the connections directly to sickness absence and productivity that still seem to be eluding us slightly in the literature. We certainly know what cyclists want and need, and I think there's good evidence for what needs to be provided. These types of things, we need employers to be supportive and not put the bike racks around the back with the bins, not make cyclists feel like second-class citizens, but like this wonderful place where the bikes are hung up right by the reception desk. And we know that physical activity is important to employers. This was work done recently on an evaluation of a London-based workplace charter, so like a health promotion programme across companies in London. And here we found physical activity was third in the list of issues. And this really got me thinking, well, as a physical activity nut, I'd like to stand up and say, yes, we must, there's strong evidence to get people cycling and walking to work, and it's going to make massive differences to workplace health and well-being, and to sickness, absence, productivity, and so on. But actually look at what the higher level, or the issues that were identified by more employers, and also, of course, think about the issues that were raised this morning. And I think we begin to realise that cycling and walking are very important, but are probably not the whole end of the deal, the whole story. And certainly sickness absence, and this is probably one of the issues behind how difficult it is to find these strong findings in the literature. The sickness absence is such a difficult measure to use. This was an interviewee in our study who said they have problems with using sickness absence as a measure. It's very slow, it doesn't capture everything. It's, there's a delay between intervention and impact, and even in the controlled trials, very difficult to show a direct relation between an intervention, a change in behaviour, and a change in sickness absence. And so then if you look a bit more broadly, away from previous NICE guidance I showed you, which was just about physical activity in the workplace, and look at NICE guidance on workplace health more generally, you can see that, of course, there are other much broader, higher level, perhaps more significant issues that employers are thinking about when it comes to workplace health. And this was certainly something that we found when we did some interviews with that City of London-based project I talked about just now. Many companies were saying, oh yes, we do health promotion, yes, we've got some healthy choices in the canteen, and we've got good bike racks, and we encouraged our employees to cycle to work. Then when you talked in more detail, you find that they also provide pizzas to their employees at 4 in the morning because they've been up all night working on a pitch. You find they also have beds available for people who have to stay all night because they're working on a pitch. And you find that they have extremely high levels of stress in the workplace. And you begin to think, well, is actually putting up healthy choice options in the canteen and putting some nice bike racks and a place where you can change out of your sweaty lycra, is that really the end of the story? And so clearly these types of issues and following these types of recommendations are absolutely vital to encourage workplaces where employees are respected and valued and feel as though they're part of a productive workplace. And I was really taken with some interviews I did in a CCG about, this was really quite a sort of light-hearted programme. This was just a sign-up step counting programme. So employees were asked to sign up on a website and compete with each other to see how many steps or how many activities you do per week. And it's the sort of thing, in my opinion, that is pretty good, comes and goes. There's not extremely solid evidence for its effectiveness. But in this organisation, it was transformational. It absolutely was. Every single person, I mean, maybe they kept the sedentary ones hidden from me and I wasn't able to talk to them, but every single person I spoke to said that being part of this scheme makes them feel part of a family, part of the organisational culture. They're kind of battling with each other to do more steps. They were having walking meetings. They were going up and down stairs while still talking to each other just to get more steps on their Fitbits. And the chief officer was talking about the impact on staff sickness levels and the knock-on benefits. But to my mind, this project wasn't so much, or in this institution, this organisation, it wasn't so much about the effectiveness of the Fitbit or the actual physical activity intervention. It was the fact that it was supported by management, they were given time to do it, and they were encouraged to do it as part of an investment in their employees' health. And this, I thought, was the ultimate. Did anyone see this? A company in New Zealand is saying we're going to give unlimited annual leave to our employees. And when interviewed, the chief exec said, and they probably haven't done it, it's a tech company, they probably want investment or something, but they said it's about investing in staff, letting them deal with their complicated lives, so that when they come back, they can be completely creative. For creative in our world, really productive. Now that's maybe the ultimate, but that's really someone saying, if we want to invest in our staff, and if we want them to be as creative and productive as possible, then we need to think about their whole lives and the whole sort of approach. And so with the City of London work, we said, yes, it was about physical activity, diet and smoking, but it's also about all these other issues of having processes in place for mental health programs, social support in the workplace and so on, bullying, anti-bullying policies and so on. So just to end, I think I've changed a bit in preparing this presentation. I normally would say cycling and walking, whatever the question, cycling and walking is the answer. But I think today I'd say there are many good reasons to promote cycling and walking, particularly environmental, social inclusion, and health, and public health benefits, particularly about making streets safer for children, particularly about reducing casualties, improving air quality. So many good reasons, but productivity, I think, is only one of them. And similarly, I think there are many important aspects of workplace health that we should be promoting, and active travel, cycling and walking, active travel is only one. Thank you.